Mental Health Policy Institute speaker series, all about implementation science. I am Tegan Henke. I'm the Senior Director of Program Implementation for the Child and Family Policy team. If the Meadows Institute is new to you, we are an organization with a goal of helping Texas to be the national leader in treating all people with mental health needs. And we do that by providing nonpartisan, data-driven, and trusted policy and program guidance. Things like this series, which was made possible through funding from the Reese Jones Foundation. And I am so excited about it. Throughout 2021, we're going to take a deeper dive into implementation science so we can better understand what it takes to launch a successful mental health program for children and youth. We'll have experts who will share insights around using data to drive decision-making, evidence-based practices, health equity, financing, and that's just naming a few. There's a lot to learn, and we hope that you will join us on this implementation adventure. Before we start, though, I have a couple housekeeping notes. Today's session is in webinar format, so all attendees are muted and cannot share video, not even accidentally. The 55-minute session will be recorded and posted on our website within a few days. If you have any audio or tech issues, please use the chat box and a member from our team will help provide support. All right, let's jump right in. For today's kickoff event, I am thrilled to welcome Dr. Melissa Van Dyke. Dr. Van Dyke comes to the field of implementation science after working in state government systems for child welfare, children's mental health, and juvenile justice. She brings not only leadership and direct service provision, but also a passion and commitment to effective professional development. She has coordinated and led various organizational and statewide program implementation and system improvement initiatives. During her 10 years with the National Implementation Research Network, Dr. Van Dyke provided implementation science and practice expertise while leading and coordinating community, state, and federal initiatives to support effective practices in mental health, child welfare, education, criminal justice, and early childhood. Currently, Dr. Van Dyke is the director of the Active Implementation Research Network and serves as board president for the Global Implementation Society. We're so excited to have you, Dr. Van Dyke. Welcome.
It's a pleasure to be here. Thank you for inviting me.
Yes, thank you. And you can go ahead and switch to presenter mode
while
I give our audience some tips. So I want to let you all know that Dr. Van Dyke will be taking questions, and in fact, we'll be pausing a couple times during her talk to answer a question or two. So audience members, please submit questions using the chat or Q&A functions. And with that, Dr. Van Dyke, the webinar is yours.
Thank you very much. So we're going to jump right in. The goal for today is just to do a pretty rapid introduction or flyover of implementation science. For some of you, this may include a bit of repetition. For others, this may feel a little bit new, but hopefully it's going to be a bit of a mix, so there'll be something in it for everyone. I want to begin by sharing some information that has come from previous learning about response to an epidemic. So there was a book written by, I don't know how to say his name, but an epidemiologist, Herbert, I'll call him Fage, who is really given credit for the strategy to eradicate smallpox. And in the book, which is called House on Fire, they tell the story about the strategy to really think differently about what does it take to fully scale up the necessary response to something, in this case, like smallpox. And partly what they address in the book is the need really to change the mindset, to change the mental model. And what they describe is the need to change the question from what can we do with what we have to what will it take to do what needs to be done. And I think I've been struck that often in our fields, whether it's social work or mental health or related fields, often the ones that probably don't get all the funding that we wish we had, that we find ourselves in the midst of compromising often, knowing at times that we're probably not doing quite what we need to do to get to the intended outcome. And we found, at least in the work I'm doing currently, that there's something about this question, about changing this question, about questioning our mental models, about allowing ourselves to question whether or not we are falling into patterns of using strategies that actually haven't delivered in the past to implement big, important change, and whether or not we need to think differently. and really think about what will it take to do what needs to be done. So I'm going to start with a little story, and this story will come up throughout our presentation today. So I'd like to introduce you to Fiona. Fiona has been working for a number of years at an organization, maybe in and around Texas. A number of years ago, she was asked to take on a big task, a big change initiative for her local community in her organization. And what she was tasked, she was really, it was exciting. People felt great about Fiona. She's skilled, she's competent. They really had a lot of faith in what she could do. And so they kind of gave her this, the sense of, you know, go forth and do good things, make this happen. One of the things that began to be clear, though, was that probably the way that they had expected things to go in this change process wasn't happening as planned. And in fact, the change process that Fiona had been set forth on, probably under an expectation that was only going to take maybe 12 months, and maybe she could fit in some of her old tasks along with these new tasks, rolled out differently. And I think for most people that have been a part of complex change efforts, you'll recognize this, that we have often a tidy plan. We may get funding in a way where they need us to have a long-term Gantt chart of 5 years of what we're going to do each month or through the years, or how we're going to use the funding and at what time. But the reality is our ability to predict where the bumps in the road are going to be is limited. And so in this case, Fiona was set out virtually on her own, probably without sufficient time or resource. And it really didn't even matter how skilled or amazing she was. There were too many unknowns. And there was probably too little opportunity to think about what could we be doing differently that would make this change process go better than previous ones. So I'm going to talk first a little bit about what we're learning about what's been getting in the way. Again, we won't spend a lot of time on this, but we have learned a lot over the years around why it is that we've been working so hard and perhaps not delivering as successfully in the changes as we would hope. And folks will have heard probably about either the no-do gap, or sometimes you'll hear evidence to practice gap, science to service gap. And one of the ways we've been thinking about it over the years has been, what is that bridge? How do we bridge? How do we bring evidence into practice, science into service? What is it that's necessary? Because at this point, particularly in the United States, we know a lot about what works. We've now identified effective practices, evidence-based practices. We know what really good science tells us can make a big difference to families and children and communities. And yet, when we go out and look around and see, you know, how well is cognitive behavioral therapy working in the community, it's pretty mixed. So there's something about how implementation's working that's allowing us to step back and say, what do we need to know so that we can begin to do what is required? So as the implementation gap was being better understood in the reviews of the literature back that was starting in about 2005, we noticed a few things. One of the things we noticed is that probably we don't always use innovations as intended with sufficient quality. Sometimes we still like to innovate, even after an evidence-based program has been really clearly defined and demonstrated that if done as intended, it will work. But sometimes you'll hear about models where maybe they're supposed to be group work, or maybe they're supposed to be role play, and people will let you know that that's probably not their thing, and so that they might skip those parts. Or we didn't have funding to add the meal in the model that was supposed to be with the family together, so we skipped that. And so this was one of the things that came up in the evidence that we struggle with. We struggle to do models as intended. We also struggle to build the sufficient capacity. So we might have a great model, we might have a few practitioners doing it really well, but we often aren't doing the work to ensure that we've planned for turnover in advance. Workers will come and go. And so not only do we need to be planning for turnover with workers, but we also need to be planning for turnovers in leadership. And so how do we begin to build robust supports in our organizations so that as we invest in effective practices and evidence-based models, we are ensuring that they sustain over time? And then the one that's still probably the biggest hurdle for us to overcome is related to scale. How do we ensure that we aren't, in essence, creating additional disparities because the very best practices are only in certain communities, only in certain neighborhoods, only available to certain families and children. How do we ensure that we're able to build sufficient capacity at sufficient scale, sustained over time, that every family, every community is able to have access to the effective practices so that everyone is able to achieve those improved outcomes? Another one of the sets of findings that came out of the review of the literature that the National Implementation Research Network did back in 2005 was related to our reliance on a set of strategies, change strategies, that were simply showing themselves to be insufficient. It wasn't that they weren't necessary to some extent, but in and of themselves, they weren't going to bring about the desired change, the intended change. And so it brings me to this photo. So this is a photo from my home state of New Mexico. So this phenomenon that the photo captures may be something you're familiar with. In New Mexico, we call that verga. It's the rain that leaves the clouds but doesn't reach the ground. And in many ways, much of our experience around implementation, around trying to move our best available evidence, our best available science, our best available evidence-based models into practice so that they become embedded and sustained in local communities and local organizations so that they benefit the populations of concern has not delivered. And so we've got lots of folks who've been working really hard, and yet we haven't seen kind of the payoff of our investments. So you may be very familiar with these findings, but what was found was that using the very best available data at the time, we were uncovering that there's a set of strategies that we rely upon that actually are insufficient. And so, but they are our go-to strategies. So this idea around changing our minds, beginning to think differently, pausing before we make decisions around change practice becomes quite crucial, because what we know now is that our go-to strategies may leave us wanting. So diffusion and dissemination of information, all the way from traditional journal articles to conferences, to websites, to pamphlets, handouts. Although they may raise awareness and be good for other purposes, networking or whatever, they won't bring practice into being. They won't be sufficient to ensure that the highly effective practice is occurring as intended. Training, no matter how well done, we'll come back and look at that one again, is insufficient. So in most systems, we rely on training to be our go-to strategy to bring good, effective practice into being. But alone, even among these strategies, it's not enough. We'll have to add some other things to it that we'll talk about. Laws, mandates, regulations may create the enabling context that allow us to do what's necessary, but alone, insufficient. Funding may even have a counter effect, but best case scenario, it creates the conditions that allow us to start, but won't deliver those changes. And then finally, reorganization, organizational change. Unless we change the functions of people's jobs to be aligned with what the implementation evidence is telling us, we're not going to get the big payoff of our investments. So in this case, in isolation, these strategies only get us about 5 to 15% return on investment. And even if we mix these strategies up, these sets of strategies don't contain the ones that we know now probably make the very biggest difference. So I'm going to pause there and check in, I think, with Jessica to see whether or not we have questions or reflections.
All right. So far, we don't have any questions, so I'm going to invite folks to submit questions if you've got any. But also wanted to just kind of reflect my own experience, Dr. Van Dyke. I'm thinking about my experience in the field. I used to be a clinician, and I know we focus so heavily on training, and this is exactly what you're saying. And so it feels overwhelming to think of all the other components that need to be there. And at the same time, what I saw a lot is that we would lose a lot of expertise when we lost clinicians. So exactly to your point around sustainability and planning for those things. And then it all just seems overwhelming when you put all of that together. Is that just me?
No, so I think it's this wonderful thing about changing our mindset. I think that's the most typical response. Yeah. I think the other common response, as you learn more and more about implementation, is you start having these moments where you think, I always knew that. I always knew more was required. I always knew we needed to strengthen it, doing the following things. So we begin to have a sense that actually we have deep implementation wisdom within us.
Mm.
But we're often in conversations, maybe with people who haven't been as close to practice as we have been,
Mhm.
who will need to hear a really strong rationale for why training alone will be insufficient.
So really like slowing down the process of implementation and putting more, thoughtful collaboration even within an organization.
Yeah, I think what I know, slowing down gets me in trouble when those words come out of our mouth, my mouth. But the idea of being methodical about using the implementation evidence so that we're doing things in the right way, in the right order, really ensuring that we're laying the foundation for us to be successful all the way to the end.
Having a process, and so it's not necessarily slow, because we know that when we need to start a new program, we need to we need to go. So yeah, okay, I like that.
Very good. All right,
Yeah.
should I jump back in?
Yeah, let's jump back in.
All right. So the next little bit is really wanting to be sure that we've got some shared terms. So I've taken you on that little journey around what we've been learning about, why we've been having such a time, why we haven't been as successful as we'd like, why we may only have pockets of successful implementation as opposed to a full system where implementation has really been able to take hold. But we've done that without defining some terms. So let's define some terms. I'm going to define implementation for us today as the study of factors that influence the full and effective use of innovations in practice. And again, implementation science is an applied science. So it strives to answer the questions, what is required? And it helps us have insights about what works, what doesn't work. And over time, it increases our confidence about how to approach complex change. So for me, for all of you that are out there in and around evidence-based programs and really thinking about what do we need to be paying attention to, I think implementation science, as much as some of the initial findings may feel overwhelming and may feel like, oh shoot, have we not been investing in the way that we should have been? We're all learning it together. So now it's an opportunity to say, what is required and what can we begin to do a little bit differently that gets us the results we desire? So as folks first started really getting into the implementation literature, one of the things that was noticed is that implementation findings often want to give us lists of 16 facilitators to change or 14 barriers to implementing your evidence-based program. And we want to move from these lists of what works and what doesn't work into making sense. And so that has been really supported in the field of implementation science by the development of some conceptual frameworks. And so conceptual frameworks identify a set of variables and the relations among them that are presumed to account for a set of phenomenon. And we're going to speak particularly about conceptual framework today that is called the active implementation frameworks, because frameworks help us capture the factors that influence full and effective implementation of an innovation. They're going to help us describe implementation situations more easily amongst our colleagues. They're going to help us identify the right questions to ask more quickly about what we need to do right now and then what we should be thinking about doing next. And they're going to help us analyze the strengths and the challenges more effectively so that we can inform our decision making going forward and be engaged in general improvement efforts. So we are going to kind of bring our thinking into this relatively linear, straightforward first effort to think about our conceptual model for this. And we're going to acknowledge that probably the first thing that we've learned in implementation science is that although implementation sits in that middle box in our formula of factors, that actually there are at least, these are the three big factors we're going to pay attention to in this first conversation. We know effective innovations matter, and we've learned a lot from an implementation perspective about what makes for an effective innovation, and it goes well beyond the strength of the evidence from the research on the innovation. It has a lot to do with to what extent the innovation is teachable, learnable, doable, accessible, well-defined, well understood, and able to be shared in that way. We'll talk explicitly about effective implementation methods very briefly, but we've also been learning about enabling contexts. And those contexts might have to do with the collaborative relationships that are necessary for an implementation effort to take hold in a community. Those enabling context issues may have to do with the political context that is either going to accept and support effective practice or make it difficult, maybe the fiscal context the way we do our contracting or the way we separate our money into categories that actually doesn't align with who our people are, that we're trying to make practices available for. And that the implementation formula really says we're going to have to attend to all three of these factors if we want socially significant outcomes. Doesn't mean that if we do a little bit in a couple of these, we're not going to get something. We're going to get something. But when we're trying to think about what it looks like to do this at scale, so it's not just some of the families, some of the communities, some of the young people, some of the children, but it's everyone. We have a vision for a day when everyone would have access to these effective practices. Then we know we're going to have to be paying attention to something in each one of these boxes in our formula for success. So I'm going to pause there because what we're going to go into next is we're going to return to Fiona, who is now 5 years on in this organization, and they have been learning about implementation science. So we're going to go back and visit Fiona to see how they're putting the active implementation frameworks to use in their change process now. But I'm going to pause there, Tegan, just to check in. It looks like we might have had some things coming into the chat box.
Yeah, so we had some great a great observation about how there are different languages that are spoken between the science and the direct care folks. And I've definitely seen that happen. So that was a really great observation. I don't know if you have anything that you want to add to that and how that impacts implementation.
It just feels like I want to be in a part of a deeper conversation about it. I definitely, we've had folks, so I started in practice and then moved into implementation science. And so for me, I like to think that there's a way that we can very quickly have a shared language, but I think it's helpful to hear people say where it's still falling short. So anyway, I'd love to have a follow-up sometime about what that person's thinking about.
Yeah, well, and it kind of gets at what our other question in the chat function is, which is that, we think about evidence-based practices and it's sort of a different universe as implementation science. And the question is, does adopting an implementation science framework potentially change how we think about what is evidence-based? So if it can't be scaled up or it can't be, implemented using the implementation science framework, is it, how is it evidence-based, or does it change how we think about it? It's a great question.
So that's a great question, and I think that gets into some of the early learning that was going on related to how in the United States we were grading evidence-based models, and the more gold standard research that was done, the more it was seen as a top-notch model, but it didn't necessarily mean that that it was successfully being implemented locally. Mm-hmm. That a lot of the models have been done in kind of, we talk about kind of a clinical context, or they've had the benefits of what were the research supports, and you take it out into the real world and it becomes this issue around, is it a usable innovation, teachable, mm-hmm. learnable, doable, accessible? And if not, it's great that it could happen under those conditions, but if they're a little too special for the real world, then we're going to have to think kind of under what conditions is that the right model? Is that the evidence that we want to put to use?
Yeah. Yeah, that's a great question. I mean, that's certainly something I've seen in practice too, where it shows a lot of evidence, but it's just almost impossible, whether it's financially or just realistically, to be able to implement, especially in, public health setting. Absolutely. Yeah, great questions. Yeah. Well, I will let you take it back over again.
Jump back in. All right. So we're gonna walk through. If we had a little extra time, I would have probably told you a little bit about each of the 6 frameworks that are part of the active implementation framework, but that might have bored you. So what we're going to do today is we're going to take just a couple of minutes and we're going to go through this story with our friend Fiona. So here's Fiona. You remember her. You remember that where she was a few years ago when her organization wasn't yet integrating implementation science into their ways of work. But we're back at the start now, in the sense that we'll say it's 5 years on. They have a new initiative that they're ready to put into action. They've gone back to Fiona because I feel like she learned a lot in that first instance, and they've asked her if she'll be a part of this next effort. But this time they're really aware that there's going to be some things about the process that are unanticipated. That's probably the only thing we can be sure of, is that there will be unexpected turns and twists in the road. So as we begin in this organization, they're very aware that what the implementation science is telling them is that it's going to take more than Fiona. Actually, they're very aware that Fiona is going to need a team. She's going to need a team of colleagues who have been carefully selected to be a part of So these aren't our practitioners. These aren't necessarily our first phase practitioners. These are probably representatives of the organization, maybe some folks from HR, maybe some folks who have been used to being around data and improvement. This is a mix of the organization at different levels in the system. These people are all really well respected. And they are going to work together to guide the organization through the implementation process. And actually, some of the learning from nationwide scale up in Norway led them to believe that when you're first starting a change initiative, if you have a vision for it going to scale, you actually want to start with too many overqualified people. Because after this first instance where you figure it out and you really learn what is needed in your organization or your community to make this happen, then those too many overqualified people can begin to lead the replications, the expansion, the next rounds of implementation of either that model or another model. So she's lucky. We're lucky at the organization. We got this team now. The other thing, actually, let me go back. The other thing that we know is that this team, based on their learning, they know that this team needs to be in monthly contact with the leaders, the strategic leadership team, the executive managements in this organization. That the leadership team sees their job as supporting this team. So it's not something that the leaders are going to give over to this team. The leaders are very well aware that although the team's been authorized to make these changes, they're going to need to be an ongoing feedback loop with leaders about what they're learning, about what is currently really aligned to support this change in practice, but also what needs to be changed. And we're learning more and more about how much clear guidance we can give to executive leaders about the work that they can be doing that really facilitates and enables these kinds of change practices. So they're scheduled in monthly to meet with those folks. Their first task, almost no matter what, even if someone came back from a conference having decided that they had picked the model that the organization was going to do, this team's job is to support the organization through a process of exploration, a process of understanding how the system currently works, how the organization currently works, and understanding then what does that mean it's going to take, what is required, what is it going to take to get to the system that's now going to be embedded and embraced and aligned to fit the new practice. So this is the point where we've got our strategic leaders saying things to us like, just remember, implementation is a process and not an event. So we appreciate that it takes some time. So we don't presuppose that we're going to get this wrapped up in a year, because actually the evidence says, if things go pretty well with a really well-defined effective approach, we're looking at a 2 to 4 year implementation process, depending on how complicated it is. And in this organization now, they're understanding that time is a part of it, that we actually strengthen our opportunities for success if we're taking the time we need to move through these stages. We do think about implementation at this point through a staged lens. So this first exploration is around creating readiness, is around preparing the ground. The Hepticon tool is down there, so you may be familiar with it. I think that the Meadows has been using it in some of its work. And it's this careful analysis of any model you're considering to be sure that it's well suited for this context, not only these families, but your community, your organization, available resources, and your ability to sustain it long term. So we're going to move then. They've been working with their local organization. They're figuring out how things currently work. They've gotten a kind of a sense of the organization or the community about what's going to fit well. They may have even come back to senior leaders to say, that first idea you had for an evidence-based program, here's what's going to be really good about it, or here's what's the limitations. So we've peeked at a few other things so you have a comparison. So they'll help inform the strategic leaders before they take the next step. Because once we've committed to a teachable, learnable, actually I should do that as next. So what we know is part of their assessment has to be, how usable is this innovation? Is this a teachable, learnable, doable, and accessible model? Is this a model that we can implement here? Do we understand what our responsibilities would be for implementing it? Does the purveying organization only offer training and so everything else is left to us? Or are they kind of a full service operation, but it also means then we've got them with us for years? So it's that kind of learning that happens in this exploration process before we adopt a model. We decide we're going forward with a model or a strategy or initiative, and that moves us into the next part of the process, which we call installation. And really installation is, I think, is really the heart of implementation science. The evidence suggests that most organizations very quickly jump over exploration. We don't take a lot of time to sort out, is this a good fit for us and what will it take? We jump over installation. We ask people to get started before we have built in the opportunity for them to build their own confidence and competence. And so at the core of the installation stage is the development of the implementation infrastructure. And some of you may be familiar with the implementation drivers, but the implementation drivers capture really the key factors that need to be attended to in any organization. And some of these factors will look really familiar. Some of these factors are things we already do, but the implementation evidence is helping us know how do we understand selecting new staff with this model in mind? How do we understand pre-training and ongoing training with this new practice in mind? What does coaching look like? And actually, on the other side of the triangle, which is important as well, decision that's used for ongoing, really informing our practice decision, our supervisory decisions, our organizational decisions. Facilitative administration is around aligning our internal organizational policies and practices to make it really easy for practitioners to do their work. Systems interventions means that where our effort to implement this model maybe is crossing in a way that is complicated with either police or with the courts or something, we know that the senior leader's job is to go and figure out how we can work together, because we all want the same good things for families and communities. So that external work that leaders are able to do, and all of it in service to doing the model as intended, because when the model's done as intended, we get those good outcomes. Foundation of the triangle is around leadership, adaptive leadership, leadership that understands the human side as well as the technical side. And then, because I'm watching my clock, I want to just make one comment around the strength of the evidence that tells us how crucial coaching is. For most of the models that you'll be looking at, probably, or that you're already using, there's probably a very strong coaching component. But along the way, we may bump into a model that has good evidence that we're really quite intrigued about, where the model developers haven't necessarily built out the coaching component, which means the organization will need to do that work. Because what the data are telling us, these data come from education, but we're seeing them as quite generalizable as additional evidence is gathered, is that even the very best, highest quality training that's skill-based, so learning in theory and discussion, you get to demonstrate skills in training, you get expert feedback as you practice this skill. But that only produces about 1 in 20 folks who can be back in the setting in which they're supposed to use that skill and do it effectively. Most of us, 19 out of 20 of us, actually aren't going to be able to embed that new skill into our ways of work until we have coaching in the context, in the setting in which we are expected to do that new practice. So each of those implementation drivers that I was showing you around that triangle have this kind of evidence that really gives us such clarity around understanding what it will take. And it allows us to look at our current pot of money and say, maybe we're going to have to use our money differently. Maybe we have to think differently about how we invest in getting people ready, at what pace, how many, because what we know is that for anything we train with the intention of having people use that new skill, we're going to have to figure out how we coach to it, or otherwise what we will have done is raised awareness, but we won't have changed practice. So Fiona and her team continue on. Things are still tricky as they are, but now they're at the point where folks have been trained. We've got coaches ready. We know how we're going to assure fidelity. We've worked on our internal policies and practices. So we've made our organization quite facilitative to this new work. And we know that with every new effort, there's a whole lot of learning going on. And so this is our phase that we know we're having to support people for giving it a shot, for trying it out, for using their words differently, for interacting a bit differently, for trying new things that maybe they haven't done with families and children and communities before. And so this is the stage where we're very much engaged in ongoing improvement, careful improvement approaches, both around the strength of our implementation drivers, but also around maybe things that we're learning about our population and how the model is landing in different ways for different aspects of our population. So there's a lot of learning going on here until we reach the point where we're able to say that we have fully implemented the model. which means we have at least half of our workforce operating with this model at fidelity, which means we can be very confident, we can predict that for that 50%, we're going to be getting improved outcomes for those folks. So this final stage, I didn't put it in, is we call it full implementation. And this is the stage where, of course, we continue to learn, we keep improving, but it's the stage where we're able to really commit to continuing to attend to sustaining and then thinking about where are there opportunities for scaling. So I'll share with you one more slide that comes straight from our frameworks, which is just to acknowledge that feedback loop that I mentioned at the beginning with Fiona and her team, where they have direct connections into that executive management team on a monthly basis, is probably another one of those nuggets that I think often gets left until later. But that feedback loop where our executive leaders are on the same journey and the same learning process with those folks that are closest to the implementation process seems to be quite a crucial way in which we can be much more successful, much more rapid, and much more able to solve the kind of problems that we know will come up through that bumpy journey. So what we know is as we approach these complex change processes, we can expect that they will be difficult, but we also have the kind of information we need at this point to be much more confident about how we make decisions about where we make our investments so that we really can deliver on our aspiration for improved mental health, improved outcomes for children's families and communities. So I'm going to call out for Tegan again to see if we have any other questions or any other reflections before I wrap it up.
Yes, we do have a few questions. One is, the coaching piece that you highlighted seems to be really critical to being able to apply the evidence-based practice in a classroom or in a clinical setting. Can you talk a little bit about how to make the coaching happen? That seems to be, one of the hardest parts. Do you build in capacity for a coach within the organization, or does that, part of the developers agreement that you have, or can you talk a little bit about the coaching process?
Yeah, so I think first and foremost, it's to know that once we know that coaching is one of the things that is required, we start with that premise based on how strong the evidence is, then it's a part of our assessment. So some models will come with a really well-defined coaching approach, and that'll be a part of the package. And it's almost like whether you like it or not, you get it, but there's benefits in getting that. Other models won't come with coaching worked out. Most of the evidence-based models that have been around for a while have been on their own learning journey, so they'll have something to offer, but they may be much more likely to leave it with the organization to figure it out. They may not have, in some ways, really worked out how to make their coaching approach usable. So that may be left as work to do for the organization. But there's lots of good information out there about that. I think the most exciting examples from evidence-based models are how much the coaching work completely aligns with the values and philosophy of the model itself. So it becomes this beautiful parallel process in organizations all the way up to senior leaders, where folks are practicing in the same way that they would work with families. And it just makes it all so much more coherent and effective.
Yes, that makes sense. One of the questions that we got was, just this idea that we can make all of the best plans in the world and, something will come in and throw it off. So I think the example that was given is, staff turnover or senior leadership might come in and really shake things up. So how do you adapt or account for that in your implementation planning?
Yeah, so it's a great question. A number of years ago, I was asked to review a set of implementation plans that came in for a federal award. And I remember that one of the questions they were asked, that everyone was asked to respond to, how were they going to attend to retention, staff retention, and turnover. And I think there was maybe 30 of these. And I was struck because everyone was willing to talk about how they were going to attend to staff retention. No one addressed what they were going to do about staff turnover. And I love it on one level, though, those are optimists. We are going to do such a good job with retention, we will lose no one. The reality is, it's almost like you want people to have a bit of a formula. Like, let's just plan. Let's just do the math from what we know. Let's know that we're going to have 20 to 30% turnover across this number of years. And so that means we're tucking away the money. If there's a fee for the training that's required from the evidence-based model, that's going to be what's going to be involved in doing really good recruitment and selection. So it is that idea that you have to, again, move your head to a place of saying, someone's going to have a loved one that's going to need their help. Someone's going to have a change in their life circumstances. We're not going to keep all of our staff, no matter how really good we are attending to retention, and we're going to plan in advance. I think the leadership one is tricky. And I think what we've learned over time is that the more connected that the process is with a full leadership team. So not just a key person. And in fact, in some of the tools that we've built to support the guide leaders on what kind of evidence are they building for themselves around what they need to be doing, we always say, you're talking at least about 2 people that are identified as your points of contact and your champions. You're never going to be led at one. And then you're on their agenda monthly, so that there's a sense of how you're always attending to how's buy-in right now, who's needing a little more support, so that even with the change of perhaps a key leader, you would hopefully have a leadership force that would be at this point really have at a place where they could be advocating for why to stay the course.
So it's pretty critical to have a leader, a high level leader who is championing this change in the organization, that's, taking it wherever they need to take it to help the initiative be successful.
Absolutely. And there's been lovely examples over the years of evidence-based models who have slowly built in administrators training, or a parallel process where their executive leaders are going on a different kind of a training course that's involving a check-in as their folks are coming up to speed for that first that first effort. And I think that those are all showing themselves to be really good examples of what good practice probably should look like.
So we have a question about staff training, and when you were talking about accounting for turnover, and if you need to, some organizations may just need 1 or 2 people trained in a practice, and so bringing in somebody to train multiple people or 2 people isn't really cost effective. So how have you seen organizations collaborate around delivering similar evidence-based practices and making training and kind of supervision more accessible?
Yeah, so I love that. And I think it probably is another one of the lessons learned. There is actually evidence that tells us that anything less than 3 folks trained to a model, 3 folks that can be connected together to be a bit of a network for each other, anything less than 3, and you shouldn't expect to be able to hold to fidelity. So there's something about us needing to be at a certain, even a small mini mass to be able to hold to the model, which I think then kind of leads us down this path of realizing that to reach the vision we have for what we want available locally is requiring us to think differently about how we work together, and about that, seeing that as a real strength as opposed to a potential risk, or I might be giving something up, or that kind of thing around competitive advantage. There's some lovely things written right now around collaborative advantage and what it means to be coming together. And maybe we're not all putting our money on the middle of the table and putting our hand away, but this idea that we are acknowledging that there is huge benefits to learning and sustaining effective practice when people are closely connected together through that process.
Yeah, that collaboration and competitiveness often, bump up against one another, and it's nice to hear that there is information out there on how to move through that. So I'll definitely be looking that up.
Is that a good place for us, or is there more?
Yeah, no, that's a good place for us right now, and I'll turn.
All right. I'm just going to wrap it up real fast. I'm just going to leave you again. We're back at our Verga. And wanting just to remind ourselves that really what implementation science is offering us is a way to think beyond maybe our go-to strategies, to remind ourselves that although we've probably become very effective at some of those and have found where those strategies have served us well, that the implementation science is asking us to begin to rely on a few different things, and to really look towards the benefit of becoming familiar enough with some of the implementation evidence that you're able to then kind of interrogate decisions with this additional lens. So to have implementation science supporting our communication around our change process, to use these frameworks to really help us with our analysis of not only what we're going to do, how we're going to choose an evidence-based program or our next evidence-based program, or which ones we want to scale further, but that it's also going to be how we begin to have a shared language as we progress through the implementation process. And that the implementation science also really helps us target the factors that are levers in our organizations and systems to be ensure that we're contributing most powerfully to make meaningful improvement in our communities. So let me see what I got next for you. So it's back to that idea that we really want to be challenging ourselves to ask the question, what will it take to do what needs to be done? And that may be having to do some things a bit differently, let go of some things we used to do, maybe make a case for folks who have liked, ensuring that everyone got the training, but now we're gonna think differently about how many people get the training so that we also have the resource available to be sure that the coaching is there so that it delivers as intended. So if you find yourself interested in implementation frameworks, there are a number of them that are very good. Some of them are more aligned to implementation research. The active implementation frameworks are nicely aligned to implementation practice. And we've attempted to make them quite usable. And so if you're interested in more information, there's more information at the Active Implementation Research Network. There's also great resources at the National Implementation Research Network, which is located at UNC. And then if you think you need a bit of a implementation community, I would encourage you to check out the Global Implementation Society and our upcoming conference in May that will bring together people from all over the world who are implementation enthusiasts in practice and in research and in policy positions, really wanting to make things significantly better for the people in their communities, in their parts of the world. So I have one more. And if you want a little bit of bedtime, go to sleep reading, you can check out our book. I shouldn't say that. It's a great book, Implementation Practice and Science, which does summarize all of the current implementation research underneath the framework, so it makes it as usable as possible. And I'm going to exit my, no, actually I can leave it here if that's a good place taken, or I can take down my slides, whatever is your preference.
You could just keep it up. Folks can start Googling Active Implementation Research Network and getting more information. If there are any last questions, I invite you all to submit them. The one thing that just has stuck with me throughout your entire talk has been this idea that implementation is a process and not an event. Because I think even in my mind, having thought about this, a good deal, I still think of it as like, okay, day one, we're going to start doing this service, and like, we've implemented, this is it. But, this idea that there's ongoing work that's happening, over a number of years, even after that first event, is really striking. And I think helpful to understand as we're talking to, people that we're accountable to. So that folks understand that this is a long-term process.
And I think we're still working on really clear rationales that speak to funders and strategic leaders around what the value of that front end investment is. I still think I have colleagues that have great analogies that in other industries, we don't expect the building to go up before they've surveyed the ground and before they've brought in the steel beams. Like, we understand that it's a process, but for some reason in our field, we kind of want things to flip on a dime. So there's something around how we're having to work pretty hard right now to help people have a slightly different mindset around the invisible work that has to happen before we're prepared to be as effective as we need to be, and as we ought to be on behalf of children, families, and communities.
Right. Well, and I think about in many organizations, the people who are doing the implementation planning, that's just another thing added to their plate. So, how do you account for, sort of people wearing so many different hats and being a full member of an implementation team?
So when we go into local communities at this point, some of the work that we're getting to do, I'm getting to do some nice work in Scotland right now. We've gotten better and better at those early conversations with local areas around the expectations of strategic leaders, around what it's going to take for them to be ready to identify who should seed their first team, even if it's just 3 people, But we always say not only will they be authorized to lead the change, so we want leaders to understand that they're giving that kind of authority and power to these folks, but that they have to have work shifted, that this cannot be added on. Now, are we 100% successful at getting leaders to do that? No, but we keep reminding them that if they want this to go at any reasonable speed, it can't be an add-on. It is a job in and of itself. And so we started here by asking people to set aside 50%, to arrange for a person to have 50% of their job in a job share, so that 50% was implementation. But we've come to the point of believing that probably unless you have a really, really ready organization that understands what that means, that may not be the right way. It may be that we really need to be saying to folks, let's look around and let's figure out which people does this really align to their job. We're not going to ask an HR person to give up their job, but we're going to want them close on the team to think about those drivers. We're not going to ask someone who's already looking at the data and thinking about improvement to let go of that job. It aligns nicely. But there might be a couple people, maybe a manager, a supervisor, who we actually would want them to be thinking about a significant portion of their job that is around helping the organization do this early, maybe for first couple of years of work.
Okay. So yeah, okay. So I'm hearing this, and that's a new piece for me to hear, is, having, and it makes total sense, because just the, inertia, getting things to move forward, I think is really difficult, especially when people have, other things going on. So having a point person whose job it is at least 50% of the time to be, kind of spearheading this and making sure tasks are getting done, almost like a project manager. And,
and we would say never one. That's another one of the early findings, is that one person leaves you so vulnerable. That single Fiona, the chance of her being your turnover. I mean, I think lots of people have the story of great progress being made and then the person leaving, and all of that institutional wisdom goes with them. So always two. In Scotland, we're starting to say always three, even if it's 3 half-time, that you want that redundancy built into the system.
Sure. Okay. Well, that makes so much sense with what you've been saying around sustainability.
It also probably makes another pitch for why collaboration is helpful. Because maybe in some organizations you think, good God, 3, how would we do that? That's all of us. But if we collaborate and we're coming together and we're sharing our capacity and we're building that implementation team across our organizations, maybe that would make it feel more possible.
Right. And having that support, and, it's always nice to have somebody to go to to vent, or to, really be able to strategize.
Absolutely. Yeah.
Well, do you have any parting words for us?
No, I just want to ask whether I pulled off the time. Like I was working hard to meet the time requirements tonight.
You did a great job. We are perfect on time. Excellent. So thank you. Oh, we got one more question, actually. What's the role of continuous quality improvement in implementation science, since we have time?
Yeah, so a lot of times we tuck continuous quality improvement into that third stage that we call initial implementation, because that's the stage where we first start to use the practice. We're really paying attention to how much we're learning, how it fits with our current system, where maybe our policies and procedures aren't supporting it, where we're learning that what we thought was going to work for coaching maybe isn't robust enough, maybe our fidelity process is too burdensome. So lots of opportunities for quality improvement there, and to be thinking about how we're looking at our data that will come from that driver's analysis and making things better all the time. But we also know continuous improvement is really, CQI is just built in throughout the whole thing. Every step of the way, you're learning something about your organization, your ways of work, and what you could be doing better immediately, or for sure you're putting it aside for the next time you're at this point in the process again.
Great, thank you. Well, I think that's it. So on behalf of the Meadows Institute team, I just want to thank you so much, Dr. Van Dyke, for being here today, sharing all of your wisdom, and really kicking this off and giving us a great foundation that we can build on for the rest of 2021. So thank you.
Well, it was my pleasure. Thank you.
And to our audience participants, thank you for joining us today. We hope you found this engaging and applicable to your work, and we hope that you will join us for our future events. Please mark your calendars for April 7th with Dr. Jen Gonzalez and Dr. Patrick Tennant, who will be sharing with us ways to use data in a purposeful way. So we're really excited for that event, and thank you all. Have a great afternoon.